Hello everyone. I want to talk to you about hypertension, but to start with, you need to know how to measure your own BP correctly because it is a dangerous thing to miss the diagnosis of hypertension only to come down with a complication of it. Or it's also not good enough to make the wrong diagnosis of hypertension when the individual is not hypertensive because it will be pills or medications and they have their side effects, including hypotension. So it is both expedient and needful that we have the knowledge about how to accurately measure our own blood pressure. Part A, be ready that you want this done. You have to be in a quiet room, get chair and sit. Don't cross your feet, please. Let the feet be on the floor. No talking while this is going on. Relax for 5 minutes before you start. No tight clothing at the hand to be used. If you're angry, that is not the time to measure your BP, to influence it negatively, to be higher. No coffee in about 30 minutes to that time. Not immediately after you finish exertion. No smoking 30 minutes before you measure, please. You place your arm on the desk of the doctor or the nurse, arm at the level of the upper heart chambers, not dangling anywhere. Then, whoever will measure the blood pressure will locate what we call brachial artery at the medial part of the cubital fossa. Any heart-trained person will identify that easily. Then, you're going to choose cuff based on the size of the arm. At 2.5 centimeters above the brachial artery, you place your cuff. Be sure that the cuff is covering, at least 75 to 90% of the arm. First, you determine by auscultation. You can use your bell or diaphragm, doesn't matter. Palpate the radial artery at the wrist and inflate the cuff. Note the BP when the radial pulse disappears. Write it down. That is your systolic blood pressure. You inflate above that systolic blood pressure for about additional 20 millimeters of mercury. Then your stethoscope on the brachial artery, you deflate gradually at the rate of 2 millimeters of mercury per second. The first sound that you will hear is your systolic. Throat cough sound, the first one is your systolic. Write it down. Then you continue to hear that until it disappears, and that is your diastolic. You repeat the same process on the other arm. You record only the higher value. You repeat the entire process if this is the first visit and use the average of 2 readings. So if you are visiting for the first time to make the determination of whether you are hypertensive or not, please be patient with your nurse and doctors. It might take you longer time. In fact, if the BP is not so high and there are no signs of end organ damage, it's not likely the diagnosis of hypertension will be made that day. you will still have to come back and they will measure it again and again. You do the same when the patient is lying down, and that's called supine, and when it's seated up or standing up, that's erect, to rule out what we call orthostatic hypotension. That is very common in the elderly, and that might be the reason why they are falling, feeling dizzy, falling, orthostatic hypotension. Well, we'll make a separate presentation on orthostatic hypotension because there are a lot that could be involved. You rule out medications that this individual could have taken that might have increased or decreased the blood pressure. Like somebody who's having upper respiratory tract infection, common cold, and he or she is taking pseudoephedrine, we might not get the true picture here. Or somebody is on beta blocker for something else, like is having tremor and they want to reduce the tremor, they give propranolol, they are measuring the BP right now, you are not getting the true picture. So let the history of medication be taken, and that will guide your decision. Repeat in the next visit until you can make the diagnosis of hypertension or not. There's a guideline for that. Maybe in another separate presentation, I'll bring out all the guidelines on how diagnosis of hypertension could or could not be made. Because it could span almost 6 different visits before the determination could or could not be made. In conclusion, diagnosing hypertension accurately starts from correct BP measurement, because that will determine the next line of actions. So thank you for listening to my presentation. Please subscribe to my channel, particularly on hypertension. We have just started. I have more to talk about, including treatment after on, possible complications, and the risk associated. Thank you.